I'm a student po of MPH, TropMed. I'm currently on my second year po. So, yun po, you can call me Jaspin po or
And
Alvin po.
you're first year ngayon. You're a first year student.
Second year na po, Doc,
Okay, so you've
actually.
taken subjects before.
Opo.
Okay, sige. So this is your second school year, tama ba?
Yes po, Doc.
Okay, sige. You're aware that there is an assignment.
Yes po, Doc. Yes po.
Okay, okay.
As po.
Sige, pleasure natin. Ladies first or would it be the new guy?
Doc, okay lang ba yung ladies first? Kasi medyo pinapolish ko pa po. Kapal ako na mukha ko, Doc.
Okay. Sige po, sino pong mauna? Naka-multiple na po ako. Multiple sharing.
Sige po, ako na lang po mauuna po.
Okay, okay. Just
open pa lang po yung account.
do also the preliminaries of what was the question, what was asked of you. I think it's about health and development and
Yes
the
po.
interplay both.
Wait, let me just access. I-access ko lang po yung file. So, sorry po, nag-hang po yung aking laptop.
Kung matagal ka, ma'am, pwede
Ito
mo.
po.
Sige,
Ay.
sabi ko sana si Ma'am Christine.
Sige po, kasi si Ma'am Christine. Okay
Kung
lang
ready
din.
na si Ma'am Christine.
Ayan, so ito, okay, na-load ko na po. So, I'll share my screen po. Share screen.
Talaga pong may tugtog na gano'n?
Ay, sorry, nasa cellphone ko po may tugtog. Ayan, silent ko nga muna. Ayan po. So, can you see my screen po?
Opo, cervical cancer po yung nakikita. Tama po ba?
Apo. So, yun po. Ang rundown lang po ng questions is yung we're tasked to choose a very specific public health issue in the Philippines. So, what I chose is the cervical cancer. And we will discuss the health development and the interplay of both in the public health issue. And yeah, and reminded to use the credible sources. So I'm going to begin na po my presentation. So the topic that I chose po is the cervical cancer in the Philippines. So I'll just give a very brief background about cervical cancer. So it's actually cancer of the cervix, which is only found among women. No? So it's caused by a human papilloma virus, particularly the type 16 and 18, and which is the most common among most common cause. No? And there are other types as well that causes malignancy, such as 45, 52, and 51. There is a 75 actually to 80% chance or probability of acquiring the virus in a woman's lifetime. So, however, not all women who gets infected with a HPV will develop cancer. So these are the risk factors that were identified that places a woman to develop cervical cancer, such as smoking, multiple sexual partners, early sexual activity, the long-term use of oral contraceptive pills, and those who are immunocompromised. So according to the World Health Organization, there are cervical cancer should encompass a multidisciplinary as components, especially covering the community education, social mobilization, vaccination, screening, and the treatment and palliative care. So this was from the 2020 published from the website of the WHO, wherein they presented. Actually, it's already a common knowledge So, but I want to emphasize here that for primary prevention, which is vaccination, which I'll be discussing in a short while, it should be offered not just to girls but as well to young boys. No, and yeah. So actually, cervical cancer is a preventable cancer. So I want to focus on my report on the primary and the secondary prevention. So for the primary vaccination, we have currently in our country, where there are three types of vaccines for cervical cancer that is approved and we're already giving out. So we have the bivalent, which is the Cervarix, the Gardasil is the quadrivalent, and we have the latest, the Gardasil 9, which is covers the 9 variants. No? So the recommendation of the CDC as well as for our own society and American and ACOG is to actually administer the vaccine to as early as 9 years old, and it's best given for between 9 to 13 years old. So if the child gets the vaccine between 9 to 15 years old, she should get 2 doses. But if she gets it between 16 to 26 years old, 3 doses is recommended. So why is it so? Why do we have to target the age group of particularly 9 to 15 years old? So because actually vaccine works best during the adolescent period. No? So the younger people have better immune response to the vaccine, to the role of the vaccine to prevent cervical cancer. And actually, the vaccine will prevent the covered types of HPV even before the patient or the woman or even the boys gets exposed to the particular virus. Okay. So, and then for the secondary prevention, we have, or actually the most common is our pap smear. So we do the cervical cytology screening, the pap smear, and HPV testing, as well as for VIA. So for the pap smear, the recommendation is actually for all women 21 years old and above who are already engaging in sexual activity or 3 years after the first sexual intercourse, and recommended to do it annually or every 2 years depending on the preparation used. For the VIA, the visual inspection using acetic acid, it's most beneficial on the rural areas because it's like a see and treat. So there's an application of 4% acetic acid on the cervix, and once they found a lesion or any abnormality during the procedure, they can already refer the patient or do a necessary treatment. For the VIA, the target population is actually 25 to 55 years old, and it's done every 5 to 7 years, given that the result on the initial encounter is normal. However, despite having several preventive measures worldwide, there's still burden of disease in our country. In fact, it is the second most common cancer among women in the Philippines, comprising about 14% of the female cancers next to breast cancer. And the second leading cause of death among Filipino women, about 6% of female cancer death. And the 5-year survival of about 44% has not improved since the 1980s. Why is this so? Because of the late stage diagnosis, no? And unfortunately, there is still inaccessible treatment to the women, especially in the rural areas. And actually in 2003, the cervical cancer screening coverage was only about 8%. Okay, so this one is from the profile also from the WHO. So they said that cervical cancer is actually very high. And when you I want to direct here that in 2019 there's about 3,100 cervical cancer deaths. So actually, the government, during my reading, there's actually a National Cancer Prevention and Control Action Plan, and in fact, it was signed as early as April 30, 2003 during the presidency of President Gloria Macapagal Arroyo. So it was declared that May is the Cervical Cancer Awareness Month. And it's our society, the Philippine Obstetrical and Gynecological Society, is undertaking a campaign to curb the cervical cancer through the increasing of awareness and medical assistance through a nationwide cervical cancer screening program. And we emphasize that it's very important to detect early. Early detection is actually a very important factor in our fight against cervical cancer. Other sections that covers the prevention, the act, is the training of trainers in cervical cancer prevention and control, which is actually the POGS, and availability of free cervical cancer screening in all trained RHU, and availability of cryotherapy equipment in every province, and school-based HPV vaccination of 9 to 13 years old among females. However, despite that, okay, so this one is the WHO 2030 target. So the goal of the WHO worldwide, which was lifted from the January 2022 fact sheet, their goal is to have less than 4 cases per 100,000 women per year. And the target is also to have 90% of girls fully vaccinated with HPV by age 15, 70% of women screened with high performance test by age 35, and again another 45 when they reach 45 years, and at least 90% of women identified with cervical disease will receive treatment. However, this is the latest data from the WHO again, regarding the HPV vaccination program coverage, which is still very low, from way behind from the target. In fact, there is actually fewer than 1 in 10 girls in the primary target cohort of 2020 have received the final HPV vaccination dose. And for the screening, there is actually fewer than 1 again in 10 women who have been screened for cervical cancer for the past 5 years. So despite the act that was being signed way back 2003, we still have this data and we're still left behind. So to end this is just my personal take, and based on what I experienced as an OB-GYN and from my readings as well, the cause of this data that we have now is the lack of awareness. I've seen this in in my clinics, that there are still women who haven't had experienced pap smear in their entire life, when in fact they're already at 40s, and even delivered, had pregnancies, got pregnant before. So I would also like to share my experience way back when 2018, when I graduated from the residency training. I was I was part of the cervical. We gave a free pap smear screening in a province in Laguna, and sad to take that I still encountered about women who were already 50s and 60s, who never had cervical cancer and who were not aware of the procedure. Another thing that may hinder us from our goal is the costing. In fact, the HPV vaccine is very expensive. So it about ranges from 2,800 to 7,500 per dose, depending on the type. And the pap smear screening as well. In the private clinics, it's about 500 to 1,000 pesos. Even in government hospitals, I've asked my friends, rotating government, there's still a minimal payment, no? And lastly is the COVID-19 scare, which is 2019. So because of the lockdown, the people cannot go out, the people were afraid of contracting the virus, as well as, in fact, our society, together with the sub-society, which is the SGOP, they recommended, it was taken during the 2020, the annual screening of cervical cancer may be postponed until there is a maayos na COVID-19 status. No? So right now, since we're already easing out, so that's the time that we already starting to encounter patients already who are who got postponed of getting their cervical cancer screening in the year 2020 and 2021. So I just want to share, so love yourself, get screened against cervical cancer, and these are my references. Thank you.
Thank you po, pero po yung i-share.
Okay po.
Back lang po ng isang slide. Yung nyo, key takeaway.
Okay po.
Okay po. Questions po from sabihin ko. Kay Alvin at saka kay Ma'am Christine. Comments.
None naman pong question. Actually, very informative po yung po ni Doc. Kanyang report.
Pero other than being informative, of course, we are not a show and tell class. Hindi naman tayo yung this is my favorite toy the last week. And hindi po ganun po tayo. We are actually having an objective. As you know, this is about health and development coming from last week. How does health play a part here? I think that's very obvious naman dun sa report ni Doktora. Yung pangalawa, of course, and sasabihin ng marami, it's not that least important. Actually, sasabihin nila it's more important is development. The development part is, I think, equally important as health. The health part, I think, was greatly emphasized. May explanation pa si Doktora. How many years na po kayong OBGYN?
I graduated po finished residency po 2017. So young pa po ang aking practice.
Relatively a baby in the
Baby practice po.
so kung 17 ano? So
17
ngayon ay 22, mga 5 years old.
5 years, tas less the pandemic, the pandemic years.
Okay po. So yun po. So but you can already appreciate siguro the development. If I were to ask you how many slides were attributed to development and how many slides were for health, ilang slides po yung in-attribute nyo to development? Ilang slides, I don't know if it was 10 slides lang po ata kayo, no? Opo. How many of that, out of the 10 slides, how many went for development? How many went for health? And of course, quantity is never a measure of the ibig sabihin, the emphasis that you would like to bring. Pwede namang isang slide din lang si development, pero sasabihin mo siya yung ito po yung pinakamahalaga sa lahat. Nagkataon na isa lang slide siya. I'm not looking actually over the quantity. Ibig sabihin, it's usually quality versus over quantity. Alin po yung dito? Ito po ba yung personal take? Andito po si or meron pa ring bahid kasi ng health eh.
Actually po, ang akin sa development is yung ito po, yung parang ito po na that it was as early as 2003 nga po. There's actually an initiative for the development. However, parang i-combine ko with the last slide, parang way back, there's an attempt to have a development naman in our country. However, may mga hindrances po.
Yung development po, siguro baka hindi rin tayo nagkakaintindihan. Development po is in terms of usually of GNP, GDP. So, baka you're using it in terms of the progress of how the program is being managed, pushed forth, advocated. I do understand that is also related to development, but that is part reductionist. Pag sabihin, masyadong focused ka lang dun sa limited. When health and development is mentioned as part of the course topics in HPAd 201, it's actually the interplay of health and economics. And, financing, progress, yun po yung ibig sabihin nun. So, tama po itong inyong ginawa. And I think cervical cancer nga is one of those, kung hindi man mataas ang cases niyan, is because siguro puro yung data collection mo. So, hindi pinagtutuunan, and alam mo naman, para rin COVID, huwag kang mag-test. Tingnan mo, bababa ang cases. Huwag kang test ng test. Test ka kasi ng test, kaya nag-i-increase yung case. So, babaan mo yung testing, and I think that has been a very, very bad strategy done to actually condition also the minds of the people who did not go to medical school. So, kung hindi ka kasi nag-aral ng medicine, nursing, or any of the health-allied related courses, madali kang bulahin. And of course, you would believe the authorities. Kaya nga lang, hindi palagay ko yun yung tamang way of, dealing with the truth is really dealing with the truth. I mean, you have to test, you have to collect data, and you have to show how many cases really there are. So, yun po yung tanong ko sa iyo, Doktora. Alin pong part yung parang barrier doon sa siguro sa stages, di ba? We diagnose first before we treat. And I think vaccination is part of the treatment approach or prevention. Siguro iba po yung barriers to diagnosis. Ano po ba yung nakikita yung development associated barriers to diagnosing cervical cancer? At the same time, kabilang question ko, magkapareho rin, what are the barriers naman to treatment or getting vaccinated? Magkapareho lang po ba sila?
Actually, siguro,
Kasi you mentioned price. Price, of course, is
price.
something Filipinos are very sensitive from. Ibig sabihin, they're very sensitive to price. Hindi lang siguro sa vaccine, pati sa pagkain, sa pag-aaral, lahat yan, paggastos yan, allergic na yung mga kababayan natin. Ang tanong ko, yun lang ba? Yun lang ba yung presyo lang ba? Is there also other things that people are fear or afraid of, or usually they are afraid of something they do not know?
Yeah, actually, mukhang sir, education, parang a lot of women still are not aware or lack awareness yun po. So
tapos meron po bang elemento ito ng myths? Ibig sabihin yung mythologies like dati kasi may sinasabi nga pambabae siya. Ngayon ikaw sinasabi mo panlalaki na rin. So I think that's part of the myth na sasabi, may mga bagong finding as studies come in, nagkakaroon po kasi ng bagong guideline. And of course, that now dispels the previous knowledge na, ayun nga, sabi mo, cervical cancer vaccination is just for women. Sabi mo ngayon, kailangan na rin bakunahan pati mga lalaki. Oh, that I think 5 years ago or 6 years ago, hindi po yan ang guideline. So it contributes actually to yung sabi mo increased awareness ng mga tao. So I just would like you to probably siguro enumerate what are those things na barriers to diagnosis and barriers to treatment and seeking help from our kababayan. Are they related to the development part the way I described it?
Yes po, sir. Related pa rin naman po sila. So the barriers po, yun nga, monetary, aside from the monetary information, no? So isa po actually there are still people na parang dependent on, parang it's very easy for them to absorb na yung sinasabi ng iba or nababasa nila through the social media. So there are instances na parang the myth po, actually the misconception about first is the vaccine. So there's a scare. Even with the COVID-19 vaccination, initially there was a scare. So what more is HPV vaccine, no? And giving it to the younger girls and boys. So and then yung fear din nila of the procedure itself, parang they thought na the common po na nababasa ko and what I encounter also are it's masakit, parang they don't need it. So yun po yung mga
substantiated po ba yun? Totoo po ba na masakit?
Ako po, sinasabi ko sa pasyente, sinungaling ako pag sinabi kong hindi masakit, but there is a discomfort. And as OB po kasi, parang, sinasabi ko I don't want to lie to them, but I tell them, there's gonna be some discomfort, and pero as long as na nagko-cooperate, nagre-relax. So, before naman, when I'm doing the procedure naman po, kinakausap ko rin sila. So, parang
ano po ba ito? Pap smear po ba ito?
Sa pap smear, yes. Opo.
So, pap smear po yung sinasabi niyo pong masakit?
Yes po.
Okay.
So, sa vaccination
naman, Hindi naman, di ba? Cotton buds lang po ata yun di ba?
Apo. Pero yung speculum insertion po yung may konting discomfort.
Okay. Sige. Tapos po, how does a overt cervical cancer look like? Symptomatic wise, ano po yung itsura ng cervical cancer siguro in its terminal stage? Ano po ba 'yon? May
Yun
bleeding
po,
po ba 'yan?
may bleeding. Usually, most common po, they present with a
So
vaginal.
kung may bleeding na po, magpa-pap smear pa po ba tayo?
Usually, hindi na po. We proceed na with the biopsy na po.
So ang
And biopsy
diagnosis
is even more expensive.
So ang diagnosis na po ng overt siguro may overt bleeding na may ano po ba to? Siguro may cellular changes na rin siguro 'yon. Kasi talagang may swelling and of course hindi talaga uncomfortable for the patient.
Yes po.
Biopsy na po 'yon.
Biopsy na po.
Magba-biopsy pa rin to confirm.
Apo, biopsy to confirm po. Tapos,
Pero no more pap smear kasi
hindi na po.
napaka-eng-eng mo naman nagpa-pap smear ka pa.
Opo, hindi na po nagpa-pap smear.
Ang pap smear mo, ang ipa-pap smear lang talaga yung mga asymptomatic, yung mga just for a routine check-up.
Yeah po, yes po, routine check-up po.
But then you admit as a young doctor in OB that there is a large yun nga barrier in terms of
Yes
cost.
po.
At combination pa, 'di ba po? Ibig sabihin masakit na, magastos pa. Lalong 'di ba, lalong ayaw mo na.
Opo.
Kasi and coming from somebody who does not know. So, yung po siguro yung yung gusto kong discussion nyo in future. I'm not saying this to you, I'm saying it to Christine and of course Alvin. Discussion should be like that. You stick with what is being asked. Of course, it's health. Andyan naman yun. Development in terms of how health and development. So, discussion mo muna isa. Health, ito yung development. Meron po kami kasing study dito with the Department of Pharmacology naman ng itong sa UP kina Dr. Jimeno, yung cervical cancer what's this vaccine and its kumbaga its cost effectiveness, kumbaga magkano siya and it's really worth it ba? Ibig sabihin prospectively if we inject kids now and what will happen prospectively if you follow them up. So dapat hindi sila magde-develop ng cervical CA kasi na-vaccinate na sila eh. So is that really good? Because so we actually looked at the things that contribute to a cervical cancer patients. One, hospitalization, medication. Tapos kukumputin mo po lahat kung magkano nagagastos doon. So whether direct or indirect cost. So, di ba this also entails absences from if you're working. So, ano po 'yon? Lost income. And of course, other members of the family taking care of you they might also be absent because of that. And of course, part of the family's income diverted. May chemotherapy po ba yung cervical CA na at hindi rin po siya cheap?
Opo, chemo and radiotherapy po.
Tas ano po yung maganda po ba yung 5-year survival rate? And is the 5-year survival a combination of radio, chemo, and of course surgical? At pag pinag-add mo na sila, maganda na. 80% na ang survival rate, 5-year survival rate. Gumaganda po ba?
Gumaganda po sir pagka early detection like kung in situ pa lang or stage 1. Pero usually nga po the problem.
Bihira po ata yung in situ.
Opo. Pero yun, early stage. Usually those na nag-early stage po na nade-detect or those na nag-routine na pap smear. Routine cervical screening.
At ang in situ po is surgical po ang approach or chemo? Or
radiotherapy po.
Kaya na, hindi na ooperahan?
Opo.
Pero magastos.
Magastos.
Yun yung part na siguro. Ano po yung normal age ng mortality kung overt CA? Do women die before they reach their senior age? Ibig sabihin early 50s, early 40s or younger pa?
I'm taking by experience lang po.
Opo.
Actually po, yung mga nakita ko po even when I'm still in training, Usually mabilis lang po. So, yung mga, especially those na late stage po yung diagnosis. Sa senior, parang
Hindi na siya
meron naman,
nangyayari.
kasi late senior na po siya na-detect. So, dahil nga hindi, by that age po, kasi hindi parang hindi common po sa kanila to get the screening.
Pero the most common symptom po is bleeding. Massive bleeding.
Bleeding pa, vaginal bleeding, usually post coital bleeding po.
Okay. Sige po. Ayun po, ito po kasi very isa siya doon sa cancer. Pag nakita po niyo yung top 10 morbidity, mortality ng Pilipinas, mataas yung cancer. Don't just equate it to prostate and lung. I think one of those is still cervical. So mataas po talaga ito. So at malaki rin po yung affinity niya with development. Yun nga po, development not in the course of management, but development in terms of yun nga, the cost, absences incurred, and not only because we are a closely knit culture, pati po yung pamilya nadadamay. Ayun nga, yung nagbabantay, and of course, it's a terrible emotional loss for the family kung anything ata na Pilipino, basta nawawalan siya ng pera, nasisira na rin yung mental health niya. Lahat po naaapektuhan. So, any more comments on the others? Doc Patrick, may dagdag ka?
Ang madadagdag ko lang po siguro, medyo extensive po yung discussion nyo. I don't know the exact data, pero dati po kasi we had a discussion on gender discrimination in terms of health service delivery. And sa culture po kasi natin may stigma, negative stigma on parang young women actively seeking reproductive health. So parang nahihiya sila kasi machichismis sila, gano'n. So yung health-seeking behavior po nila ay highly affected. So hindi ko lang po alam kung ano yung exact data on that. Pero baka po kasi affected din sa pag-seek nila ng HPV vaccine. So
Okay.
yun po. At saka yung, of course, when you get the cancer, you get very sick, no? Especially if it's in the late stages. So talagang affected po yung output nung not just the patient but the caretakers. Sa PGH po, laging may bantay, and usually it's their children, no? Yung nakikita ko po na may CA noon, no? So and kapag terminal po, ano po 'yan? Usually yung sa experience ko po, marami pong nawawala, like they pass on, no? So yung emotional toll, marami po talaga. And you know, napunta na po sa forefront yung mental health, especially during the pandemic, kasi tumaas yung cases ng mental health issues sa population. So parang mas na-emphasize na yung impact niya sa development din. So, yun lang po.
Yeah, salamat, Doc. So, yun po, malaki po yung, I think, Dr. Dayan, you parang struck gold, quote unquote, that you could actually pursue this more. And if none of your colleagues are looking at it, I mean, not just looking at it, alam mo naman yun, routine naman sa atin yung we diagnose, we treat. But if there is a substantial portion of the population not getting the help that they should be getting, I don't know, marami kang pwedeng i-advocate dito. Advocate to include this as part of PhilHealth support para sila lang ma-encourage. I don't know, as part of health promotion. Ayun lang. I think malaki yan eh. Malaki yung marami yung may ganyan. And is it doon sa proportion na may cancer, ilan yung talagang diretso, pwede mo ba sabihin 90% are caused by HPPB? Ano ba? The papilloma. The papilloma virus. Lahat sila caused. So, ayun nga, it's one of the few cancers caused by an infectious agent. So, malaki po yung ano nito. Parang ibig sabihin, marami pa kayong pwedeng gawin. And you're too young, a doctor. I mean, ibig sabihin, I know you will last 100 years. Kung 100 years ka pa or more because they discover a new drug again to lengthen life, parang ganyan. I think you can contribute more here and probably start something big attributed to you. Parang ikaw rin na isang magiging luminary sa ganyang field. So marami pong salamat for bringing this into the table. again, it's very relevant subject. Again, kindly submit po. Dahil wala pang Canvas, please submit to email addresses of Dr. Patrick and myself. HPAd 201, assignment number 1, and then your surname. Attach nyo lang po ito as is.
Okay po.
Okay po. Pwede nyo pong for all assignments, convert it into PDF file. Baka kasi merong suspicion na gagamitin namin ni Dr. Patrick. Wala po. Lang, pang document, nag-grade namin kayo. So, of course. Next.
Sure.
Ayun po. PGS Silim po for Dr. Silim. EA Faraon po at up.edu.ph for myself. For all, po ito, we submit after. Ito ngayon lang po, after presentation. But for succeeding assignments, I would require a Friday, kahit 11:59 p.m. submission, just to be fair with, kasi minsan nagre-report si Dr. Dayan. No offense dun sa dalawa, ginagawa nila para based dun sa comment, nakakapag-tweak pa yung iba. So, kung sabay-sabay magsasubmit on a Friday evening, patas po yun for all. Kasi we will present it as is. If that is okay with you, we will proceed like that. I'm annoyed that you are 3 when I know there are more. Wala namang nag-drop sa atin pa, Doc Patrick. Hindi ko alam na bakit wala yung iba. Okay, sige po. Thank you, Dr. Dayan. Sino susunod? Alvin na ba o si Ma'am Christine?
Wala po muna, sir.
Go po. Nakikita na po namin yung screen.
Okay po.
Thank you. You may proceed.
So, good afternoon, everyone. So, I chose the topic COVID-19 vaccination. So, before I discuss about the interplay of COVID-19 pediatric vaccination and the interplay of health development, I will first define what is health and development. So, health, as defined by World Health Organization, is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And development is the process of providing the conditions that offer opportunities for improving the quality of human life in a community. Hence, when health and development is combined, health development is a process of constant progressive enhancement of the health status of a population. The notion of development as managed process has been derived from the work in the field of economic and social development studies and now is being applied to health systems. So for the COVID-19 pediatrics vaccination, it is one of the public health issues in the Philippines right now. So before I proceed with that, I'm going to give you a brief background for what is COVID-19. As defined by World Health Organization, coronavirus disease or COVID-19 is an infectious disease caused by the SARS-CoV-2 virus. The virus can spread from an infected person's mouth or nose in a small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from larger respiratory droplets to smaller aerosols. So, the best way to prevent the virus spreading is to protect yourself and from staying at least 1 meter apart from others, wearing a properly filled mask.
Excuse lang po, Ma'am Christine. Ano ba bang nangyayari? Meron tumutunog sa inyo. Pwede po bang mag-unmute?
Ayan
Meron
po.
po tumutunog. Tot. Ano po ba
Feeling
yun?
ko po yun sa ano po yun sa mic.
Tot.
Sa mic ko po siguro.
Mic po namin? Mic ninyo?
Mic ko po mismo kasi po parang nakapang ano po ako. Yung mic sa desktop po kasi ako.
Okay. Yun yung
Ayun.
sinasabi ni Dr. Si Dr. Pat merong
Yung may ano,
tumutunog daw po. Sige po,
sige.
pakiulit lang po uli. Tapos
Sa
tingnan nyo na lang po kasi wala pong atang lumilitaw na text doon sa inyong slide o talagang ganun po yung plano ninyo.
wala pa po talaga siya. Cloud pa lang po yan talaga.
Okay.
Okay, ayun po.
Thank you.
So, yan. So going back, so washing your hands or using an alcohol-based rub frequently and most importantly, to get vaccinated. So in one of the articles that I saw in the Philippine News Agency, it states that the pediatrics vaccination caused an undue fear and have stirred considerable vaccine hesitancy among parents and guardians. So the vaccine hesitation is one of the burdens that our health department must deal with to obtain a high vaccination rate in our country. The rampant misconceptions about vaccine efficacy and safety remains amongst common Filipinos. So in this time of pandemic, getting a vaccine is highly necessary in order to prevent COVID-19 and further complications it might bring. Hence, it is important to spread information about vaccine efficacy and safety to correct the rampant misconceptions and misinformations. So what needs to be done? So first, we must have counseling. It must be conducted for the parents to understand the benefits of vaccination for their children. It is vital for them to understand the facts, such as what the vaccine will do inside the body and can do to prevent serious complications of COVID-19 to increase compliance. Honest information is also important, that the healthcare providers must be honest with the side effects that may occur upon vaccination to maintain trust and convince the parents from vaccine hesitancy to acceptance. So the interplay between COVID-19 vaccination and health development is the Philippines already economically suffered from a deep recession in 2020 due to the impact of COVID-19 pandemic, with GDP contracting by 9.6% year on year. Getting vaccination lowers the risk of spreading COVID-19, prevents serious illness and deaths, and children may resume activities with proper precautions. Hence, changing the standpoint of pediatric vaccine refusers is critical if we are to return to pre-pandemic normality. That's all. Thank you po.
Please do not unshare. I was not sige, questions muna from the classmates, Dr. Dayan and Alvin. Comments and questions. Sige po, go ahead.
Sa comment naman, sir, parang it's very timing po. Kasi we just, di ba, recently lang po nag-roll out ng COVID-19 vaccine for the kids. So the topic is very timing. And I think yun nga po, encouraging more people to get vaccinated. Kaya parang it's our goal, we have a common goal to end the pandemic. So yun po.
Okay, thank you, Dr. Dayan. Alvin?
Doc, yun po. Tatanong ko sana yung regarding sa on how to further convince yung mga parents on how to on paano sila babaksinan. So yun po.
So, yan, mahalaga na ipaintindi dun sa parents through counseling. Kung hindi man sila yung pupunta mismo sa vaccination site, siguro more on spreading information pa na to barangay level na merong kung possible na magbahay-bahay na para kausapin yung mga magulang ng mga bata. Kasi yun lang talaga yung way para ma-convince sila, is ipaunawa sila kung ano yung pwedeng magawa ng bakuna para sa mga anak nila at mapaprotektahan yung mga bata kung ipapabakuna nila.
Okay. Okay ba yun, Alvin?
Parang follow-up question lang, Doc. Since yung vaccine hesitancy po kasi, Doc, as what I experience po, on my opinion lang po, is parang ano po siya, nagva-vary po siya by surge. So since actually po I work in a molecular laboratory near a vaccination site. So during the Omicron Omicron out yung surge, sobrang dami po na nagpapa-booster, and since ngayon na nag-level 1 na po, kumokonti na. So yun po, sa tingin mo effective pa rin yung parang bahay-bahay if in case na level 1 and medyo mataas pa yung vaccine hesitancy as of now?
I think ang ano na lang niyan, possible na hindi rin siya maging effective kasi yung iba talaga mananatiling sarado yung belief nila, saka magiging parang ano na sila, relax dahil nakikitang lumuluwag na. Pero eventually, kung mas mapapaintindi sa kanila yung worst case scenario na pwedeng mangyari sa mga bata kung hindi pa bakunahan, maybe baka ma-convince sila, ma-shift yun from hesitancy to acceptance.
Okay. Okay na yun, Alvin?
Yes po.
Okay. Doc Pat?
Hello. Thank you for the presentation. Yung comments ko po dyan, as Ma'am Diane said, it's very timely. Lalo na before nag-try mag-open to face yung ibang bansa like the US, and they found that kahit na hindi like asymptomatic yung mga children nila, they were carriers of the virus, and ang naapektuhan yung mga parents nila and caretakers. So I forgot the exact number right now, but meron ng tally na millions of children have lost at least one parent or caregiver during the pandemic all over the world. So very, very timely to, because especially since we're transitioning to face-to-face sessions, baka mangyari yung nangyari before, no? Especially with the variants being more effective than the what was that variant? Alpha variant yung pinakauna, no, Doc? Yun. So very timely, although even I cannot fully answer the question about vaccine hesitancy because it's an ongoing issue right now. It's a balance between ano kasi yan nag-iiba po yung arguments ang nangyari dyan. Some of them do not like to be vaccinated because they were told that it was harmful. Some of them are okay with vaccination but they do not want mandates. Parang ganun, like paiba-iba po yung sasabihin depending on who you ask. So it's a really complex issue that is hard to answer with just one solution. You know, so yun po. Timely siya, pero hopefully we do get close to pre-pandemic normalcy.
Okay. Thank you, Dr. Pat. So I do agree that it is a timely topic that you have tried to present, Ma'am Christine. Kaya nga lang, I think I fail to appreciate whether it was vaccine hesitancy or the pediatric vaccination, the development part again. Ano po, saang part po kaya na-discuss yung development part? Again, if you listen to the discussion I had with Dr. Dayan kanina, saan kaya yung development part? Development of course is everything that is not health, but all leads to health. So development is income, development is education, development is infrastructure, development is even mental health is part of the development. Kaya nga lang, saan po yun? Saan po na-discuss dito? Parang I did not see it in what slide was talking about vaccine hesitation, pediatric vaccination, and what was the part where development was discussed?
Sir, sa development dito po sa last 2 slides. Kasi parang dito na po yung magkakaroon ng education. Then,
pero hindi siya overt eh.
yes po.
Hindi siya malinaw. Parang, 'di ba, parang i-shoot mo na lang yung bola kasi ano na magsi-zero point play na. If you're familiar with basketball, players usually try to do a 3-point shot. Kasi wala na eh, kailangan na Hail Mary. We call it a Hail Mary. Much like the people in Ukraine and Kiev now, they're also praying for a Hail Mary because wala naman sila talagang laban, kung labanan lang ang usapan. Yun ang ibig ko sabihin. I did not see it, but this will do. Kindly submit it. I hope you see what the interplay. Hindi ko kasi nakita yung interplay. Yun ang hinahanap ko eh. The interplay between health and development. Not the development of the pediatric vaccination or vaccine hesitancy. Hindi yung the way you perceive, parang if you go kasi to Merriam-Webster or the Oxford Dictionary and you try to define development, syempre, ma-define doon is the progress from a point of low development to a portion of a state of high development. Ang ibig kong sabihin, nasaan yung development dyan? If we get vaccinated, what would happen?
We might return to pre-pandemic normality kung ma-achieve po yung rate, which is sa last slide ko po nabanggit.
Hindi nga, yung ano nga, in terms of ano yan kasi economic ang usapan.
Economic, pwede na po tayo mag-resume sa normal.
Oo nga, pero hindi ko nakita sa report.
Ay, hindi ko po siya nasama talaga doon kasi hindi po ako aware na ganun po pala.
Pero inilista ko yun sa WhatsApp natin
Sir, di ba po kanina lang po ako na-join po dun sa correct group po.
Pero nasabi ko naman lalo no last week.
Ako na development, pero yun nga po.
Before tayo naghiwalay. Sige. Ano ba yun? I think sige. Sana magsama-sama tayo sa parang we communicate on one page para I think choose a very specific public health issue, discuss health and development and the interplay of health and development with regards to the public health issue you chose. So if you chose pediatric vaccination and vaccine hesitancy, how does it paano makikita yung interplay nung dalawa? So, yun lang yung aking hinihingi. And then please do not forget to cite sources, which you did naman, and Dr. Dayan also earlier on. So, sa future na lang po, paki-submit na lang din po ito as is. Huwag mo nang dadagdagan, as is na. Yan na yung iyong output. Thank you very much, Ma'am Christine. Last but not the least, nagpahuli si Alvin. Meron pa tayong isang kaklase, ang pangalan niya Ida Urian. Natatandaan niyo ba si Ma'am Ida last meeting? Or wala kayong natatandaan ganun tao?
Familiar po.
Sige. Wala siya ngayon. Hindi rin siya nagpaalam sa akin. Si Ma'am Jonah nagpaalam. Kaya magpe-present siya ng kanyang assignment next week. Ayun. Sige po. Go, Sir Alvin. Ano pa pala sa 4th week? Sir Alvin, ready? We see your slide. Go po, go.
Ano po, ayun po. So schistosomiasis po, which is a neglected tropical disease. So to begin with, schistosomiasis, also known as bilharzia, is a disease caused by parasitic worms. So schistosoma species infects individuals through snails and through animal and invertebrates that serves as their vector. So these listed are the endemic areas currently which is treated in Luzon, Visayas, and Mindanao. So in Gonzaga, Cagayan, in Oriental Mindoro, in Luzon, in Visayas, Northern Samar, Leyte, and Calatrava or Negros Occidental, and also on provinces in Mindanao except the Sulu archipelago and Misamis Oriental. So as what you can see, the provinces in Mindanao, except Sulu archipelago and Misamis Oriental, are and also in Visayas, in Luzon, you can see schistosoma infection actually on areas where farming are a practice, so it is their livelihood. Next is the current status of schistosomiasis. So according to the DOH on 2018, the national prevalence is 4.68, and the barangays infected only have less than or greater than 1%, but less than 5%, and 379 or 24% with prevalence of less than 1%. So with that prevalence, there are some studies that says that schistosoma are already near elimination. However, there is a study made by Oliveda et al. Wherein they studied use a retrospective national utilizing retrospective national survey data, wherein not all people who are treated for schistosoma are taking the tablet. So the numbers are very confounding. So next is the effects on health of schistosomiasis. So the first is anemia, growth retardation, malnutrition, and impaired cognitive function on preschool age children. Low birth rate of babies on infected mothers, and fibrosis and granuloma on adults. Also, as mentioned by also Oliveda, schistosomiasis is the number one on producing disability adjusted life years. So disability adjusted life years are global burden disease measures wherein they measure life years lost due to that disability. Next is our current strategies against schistosomiasis. Currently, there is health education and behavioral modification on residents near endemic areas. Also, there are improved sanitation. They are provided with toilets and safe waters. Snail control has been done since it is the vector. Also, there is a mass drug administration. However, this mass drug administration are community-based and within only the area. So in the study made also by Oliveda, they have proposed further strategies for schistosomiasis, since up until now it still persists. So they have suggested that replacement of tractors instead of water buffaloes, since studies made by Mario G's also et al. Also showed that water buffaloes are a vector of or are carriers of schistosoma parasite, and also elimination of reinfection. The study proposed that the schistosomiasis can be eliminated if there are reinfection through enhanced delivery of mass drug administration. So within the area and also on the nearby areas, there should be a mass drug administration. So as you can see in here, there is a graph in the study of Leonardo et al. Wherein these are the provinces that are infected with schistosomiasis and are also endemic areas. However, I also in the other graph, there is a snail infection rate in which Northern Samar has high prevalence of infected snails. Northern Samar on both chart shows a high prevalence of the disease and also the infection, and therefore proposed strategies on elimination the current strategies are working for snail control on against schistosomiasis. So the next is the impact of schistosomiasis on development. So of the individual. So for pregnant women, they are in high risk because of the infection. Also, the babies are dying because of their low birth weight, or have poor quality of life because of their low birth weight. On children, since nadodoble ko po ata. On children, they have poor school performance and poor quality of life. As what mentioned earlier, schistosoma causes anemia on children. So this anemia causes lethargy, in which also um, makes them perform in school very poorly. So on an individual level, on other adults, there is a poor performance and poor quality of life. As what I mentioned earlier, schistosoma produces a great number in disability adjusted life years, and reducing schistosoma is um, number two on reducing the disability adjusted life years. So if if you're already infected with schistosoma, you will lose your capacity to work, or your capacity to provide for your family. Therefore, um, rendering you still on that malice. And that's all po.
Yun na yun. Yun na yun. Tapos na.
Yes po,
Okay.
Doc.
Again, I would appreciate outlines on how you try to present your for all those who presented, wala kayong outline. Pakilagyan nyo ng outline on how you, di ba may questions, may assignment si Doc Emer. For every question or whatever it is that guideline na ibinigay for a individual assignment, what you will present as a PowerPoint should actually be presented with a how you plan to approach it. Ibig sabihin, these are the questions. Halimbawa, yun nga, interplay of health and development. How do you intend to present that? So in the slide, ito, parang outline presentation. I'll discuss first about this one, this one, this one. Bullets lang naman yun. 1, 2, 3, 4. Or bullets. So again, my same question. Alvin, interplay of health and development. Asaan yung health? Asaan yung development? Health is probably very clear, but where is the development part?
Dito po, Doc, sa effects on health, ito po yung health. Also yung sa development po, nandun po, nilagay ko sa dulo. Pero po, yun po, since they are inflicted with that disease po, yun po, naglulose po sila ng capacity to work, or capacity to perform well po. So with that po, lalo lang po nagtutuloy yung cycle po. So kunyari po, ito po, for high risk, for pregnant women, babies are with low birth weight, and then these babies who has low birth weight, ayun po, poor school performance, and then these children turn on will lead into individuals who have poor health, and therefore the opportunity to work are affected po.
Okay. Comments from the class? Dr. Dayan, Christine, wala na. Tatlo lang kayo. Hindi nagpakita yung dalawa. Sige,
Ako po,
ma'am.
sir, i-share ko lang. Actually, more of share. Kasi naalala ko po yung it was last year po. No? So, para yung nurse po namin sa hospital approach me, nag-atatanong particularly about this schistosomiasis kasi yung relative yata niya is nagtitreat daw. And during that time kasi, the relative was stuck in Metro Manila. Pero the treatment daw kailangan pang kuhanin sa Leyte. I think sa Visayas.
Yes
Hindi
po.
naman sila makalipad. So, hindi ko rin siya, although hindi ako helpful, pero na-remind lang ako dun sa aming conversation na yun nga. Ganun ba siya talaga na hindi siya basta-basta nakukuha dito. Kailangan niyang lumipad sa Leyte. Which is hindi niya na-continue that time yung treatment. So hindi ko rin alam naman yung follow through about the story.
Yes po, Doc Dayan. Yun po, dito po sa part na to, yung sa current strategies po, yung mass drug administration po natin is community-based. So kung saan ba po, let's say, ang area lang po is Leyte or ito po, dito po sa mga endemic areas po like Gonzaga, Cagayan, dyan lang po sila nagka-conduct ng therapy. So yun po, if we want to further eradicate schistosomiasis po, we need to enhance the mass drug administration, like having a records of those that are infected also, or those individuals who are taking medication and are waiting for reinfection.
Okay.
Thank you.
Ma'am Christine, and may comment ka ba dito, Ma'am Christine, sa Shisto?
Isto, kung yung iba yung, paano nyo mapapababa yung kunyari na reinfect tapos hindi naman na sila pumunta sa yung sa mass vaccination, parang nagkakaroon ba ng effort to reach out to them pa talaga, or kung hindi sila pumunta sa mass vaccination, parang wala na, lost to follow up na sila?
Actually on that po, dapat nga po they should be followed up. Dito po sa study ni Oliveda, DOH is claiming that we are near elimination po. Pero kinorek naman po nila na national prevalence is 4.68%, hindi na less than 1%. Before po kasi kinlaim po nila. Pero po, yun nga po, marami pong nag-react in which hindi nga po natitake yung mga gamot ng mga population na infected. So hindi po na-follow up kung natitake po yung gamot. So if for me po, if other than strengthening po, dapat po talaga other than strengthening yung mass drug administration within the area, dapat po yun nga pina-follow up sila or reminded of taking the drugs, and also po yung health promotion din po.
Dr. Pat? Shisto?
Hello and thank you for the presentation. Iano ko lang po na talagang mahirap magkasakit lalo na kung hindi ka insured. Lalo na your work is always inextricably linked to our health. So ang ating production, yung productivity natin is dependent on us being healthy both in mind and body. Gusto ko lang pong makita kanina may parang binanggit kayo na is yung kalabaw ire-replace ng tractors. Is that your proposal or ginagawa siya ngayon? Is that a program?
Ito po actually is a program naman po siya, pero since costly po talaga yung replacement of tractors, others have resorted po on wearing boots while planting po or while farming. So meron naman pong areas po na replaced with tractors, such as areas in Mindanao, same with as the study Oliveda. They have the government procured tractors for residents of I think pala Mindanao, Visayas, which is Leyte. Two tractors in a farm.
So that's a local government project.
Yes po.
Yeah. Okay.
Parang po siya. This is just a proposal lang po, pero yun po may mga nag-resort na po on providing tractors and automated yung automated po na pang-araro.
Okay. That
But
kind of just caught me off guard kasi yun nga mataas ang capital sa isang venture na ganyan, and it takes a lot of computation and planning to even implement something like that. Bibigay ka ng tractors. Like saan napunta yung mga kalabaw?
Actually po there are studies po. Di ko lang po na cite dito. Which is I can place naman po yung kay G's na since they have found that there are water buffaloes nga po, yung mga kalabaw po na infected, dinisplace po talaga nila yung kalabaw. Tinreat po nila bago nila i-displace, and then ayun po, parang nag-resort sila sa naka-boots, or nag-resort sila sa ano po, sa tractor. And since yun nga po, yung tractor is a very very costly po. Yun po, more on naka-rely po siya sa local government unit on procurement of tractors po, ganun.
Okay.
Pero sa ngayon po, focus on ano po siya. Also parang One Health approach din po, na in which yung animals are treated, yung environment are treated with yung anti-snail po. Tapos also yung mga tao is treated with also prosequental po.
Yeah, well, I guess it's an indictment lang that health and development not exclusive and not bubbles of their own. So, yun lang po. Thank you.
So thank you Dr. Pat, and of course Alvin, paki-send. I also sent a message now to WhatsApp na paki-submit. I also added you, Doc Pat. Akala ko naka-add ka na doon. Wala ka pa pala doon.
Yes, natangkap ko po. Thank you, Doc.
Sa WhatsApp natin. And I count 5 people. Ayun nga, so 3 lang yung nagpa-unlock sa atin ngayong Sabado. Siguro they're on EDSA celebrations. So sana next week na sila nag-celebrate. Okay, sige po, maraming salamat for your presentations, and I will actually discuss with you now the health and development with the remaining 30 minutes or so, 34 minutes of our time. I hope you can see the slide, health and development 2, social determinants of health and inequality. Na malinaw po ba ito? Can you see this clearly in your screens?
Yes po, Doc.
Yes
So,
po.
ito po yung ating pangalawang session. Nagko-convert pa rin ako nung klase ko kaninang umaga, hindi pa tapos. So sometimes it might interfere with the pages. So I will explain relevant parts of the Alma Ata in relation to health and development, and why it is the document I would like to relate to as far as health and development is concerned. Discuss an overview of the Astana Declaration. It's I think the same thing 40 years hence after Alma Ata. Explain the social determinants of health. When you see the terms SDI and HDI, what does it mean? Provide the roadmap given in the current Philippine Development Plan. This, of course, this supposed to end this year. This is usually related to the term of the president, whoever is the president. So alam niyo naman si President Duterte is ito yung term niya, 2017 to 2022. And then give examples of global initiatives as far as health and development is concerned. So ito lang po yung picture in one slide, parang explain health and development. Ayan lang po ipapakita ko. And then say thank you, and then tapos na po. Class is adjourned. Favorite slide, hindi naman ganito yung slide niya. A colleague of mine who works in the Universal Healthcare Study Group, Dr. Butching Paterno, usually shows a contrast in Metro Manila. Nakikita nyo po yung nandun sa likod, mga building. Clear po ba yun sa inyo? And of course, the houses. These are houses actually, living conditions. So ito po yung social determinants of health leading to development. And I'm sure you can see development spelled here in terms of how we live our lives in Metro Manila. This is the reality. Ito po talaga yung nangyayari ngayon. In the phase of development, there's still people, a portion of the population left behind. If you can call it that. Hindi po maganda ang housing condition nila. Kung makita nyo ito pong ganitong klaseng housing, ay napaka-vulnerable nito sa, I don't know, what category, what particular nuts po kasi ang ang measurement pag may bagyo or the speed of the wind when there is a typhoon. I don't know if it's clear with you, there are people here. Meron po mga nakatayong tao dito. Ito po, may school boy siguro to with a backpack. And I think that's either the window of his house or a sari-sari store and is trying to buy something from that. So, tabi-tabi po ito. And in this house, huwag po kayong mabibigla. There could be 1, 2, 3, or even 4 families living in just one household, one door. Kung paano po sila nagkasya doon, I think familiar naman kayo siguro sa measurement ng houses, square meters, magkano isang square meter, gaano kalaki ang isang square meter, what probably is just your bathroom or your toilet could be already the full house for them. And there might be 2 to 3 families living in that particular restrictive space. So when government announces during 2020 we called it ECQ, and then I think nabago, ginawa siyang alert levels. What do they mean? They mean a house quarantine. So pag mag-house quarantine ka, ibig sabihin nun, andun ka sa loob ng bahay mo. Hindi ka lalabas, hindi ka makikihalubilo sa mall, naka-lockdown. Pero kung ganito yung setup ng quarantine area mo, tingin ko magkakahawa-hawa rin kayo. So the sense of quarantine in its technical definition is lost. So the necessity for an active local health group, your so-called barangay health emergency response team, should be able to visit and actually map who among in the population, their respective governance scopes live in places like this. And usually places like Makati or Ortigas, Pasig, even BGC, which is in Taguig, have a portion of this. Ito pong mga informal settlers, meron silang ganito sa kanilang population. So dapat na ma-map out mo yan because in the spirit of being inclusive, kasama po sila dapat. And those people should are also part of the community. And when you talk about health and development and the achievement of health, I will discuss health. Ito po yung declaration of Alma-Ata. Where can you find Alma-Ata? You type it in your Google search engine or your browser. Makikita po nyo yan at madadownload nyo yung Alma-Ata. Section 1 actually tells you that ito po kasing Alma-Ata was born in 1978. I don't know if any of you was born already in 1978. This was Alma-Ata is a place in the then USSR, what you know now as Russia. And 134 nations agreed to this declaration to promote health and development. Ayan, wala kagaya dyan. Pledging urgent action. They had a deadline set for themselves, health for all by the year 2000. Ngayon po is 22 years after the year 2000. Wala pa rin nakaka-attain noong tinatawag nilang health for all. Ang kanilang gustong mangyari po is health world community to protect and promote the health of all people all over the world. Ang kanilang formula, ibig sabihin the strategy that they will use is primary health care. Nasaan po yung primary health care niya? Nandun din po siya. Nakadefine din po siya doon. Kaya talaga pong nakikiusap ako sa inyo. Paki-download po ninyo, paki-basa po ninyo. 2-pager lang naman po siya, made up of pinagpira-piraso pa into several sections para madali pong maintindihan. So doon po nakalagay, I think number 3, section 3 was that they were looking at economic and social development. Yun po yung inaas nila talaga. Based on a new international economic order. They foresee this, looking at that during that time na mangyayari na 2000. So it's one of the basic importance to the fullest attainment of health for all, reduction of the gap between the health status of developing, yun ang tawag doon dati, developing and developed countries. So develop po, yun yung mayaman, developing yung on the road sa pagyaman. So the promotion and protection of health of the people is essential to sustained economic and social development, and it contributes to a better quality of life and to world peace, which is, I think, one of the ultimate goals of the Alma Ata Declaration. So, 2000, yung kanilang timeline, pero fast forward po to 2018, so this was 2 years before the pandemic, nagkaroon po uli ng isa pang declaration. Looking forward, they actually was using the Alma Ata Declaration as the basis. So dahil naman ngayon, hindi na 2000 kasi tapos na nga yung year 2000, a vision for primary healthcare na in the 21st century. Making the case again, pushing for primary healthcare. So it has an economic outcome, it has a health outcome, and how responsive is it? So they have a vision, and on the other side of the vision is the operational framework. So yung kasing vision is a dream. So pwede kang mangarap na mangarap pero wala ka namang gagawin. So yung sa kabila, nangarap sila, at the same time they have a framework for action. So health in all policies, empower all individuals, develop a primary healthcare workforce. There should be strategic purchasing, which brings us to our next lecture next week, which is health economics, and an introduction to that. A private sector, a quality, of course, your primary healthcare, you should give services which are of quality. Then digital technologies, integrating health services, integrating public health and primary healthcare, the role of hospitals in primary healthcare, also looking at AMR, antimicrobial resistance, primary healthcare and health emergencies, and the notion of rural primary care. So, dinivide po nila yan into meeting health needs to primary healthcare, regional reports from all continents, Africa, Americas. This is usually divided to the continental divisions that the World Health Organization has for its main offices. And then country case studies. So meron silang ganyan, best practices on how to achieve health for all through primary health care. So the Astana Declaration was made 2018. It was again unanimously endorsed by all WHO member states, and it had 4 key areas. So to make bold political choices for health, which I think is very timely also kasi meron tayong presidential elections and local government choosing also of senators, senators lang, vice president, tsaka president ata. So to make bold political choices, ano ba yung health agenda nila? To build sustainable primary health care. Kasi usually ano yan, mingas kugon gagawin. A medical mission is not primary health care. Kasi a medical mission happens once and then wala na. Mangyayari uli next year o siguro the following year. Pero ganun siya. Hindi naman ganun yung primary health care. It should be sustainable on all days of the year. Then empower individuals and communities. And lastly, align stakeholder support to national policies, strategies, and plan. So again, the interplay of health and development. Yung health mo ba, does it sit with your local government head? I mean, your mayor, your congressman, your governor. Does it sit with their campaign promises? Kasi kailangan naka-align po yun. Kasi kung hindi naka-align, may mali na naman. So dapat ituwid po yun. So what do we mean by social or societal determinants naman? The social determinants of health is everything, is the conditions, namely social, physical, economic, in which we were born, we live, we work, we age, we study, and our access to healthcare. They consist of all the policies, the programs, the institutions, all the other aspects of the social structure. including the government and the private sectors, as well as community factors. The societal determinants of health through social and physical environments. So what is the role of public health in this social determinants? Public health usually crafts, they usually develop those policies and activities. They usually revise, they usually revisit, they usually evaluate those policies and activities that, when implemented in other sectors, including medical care, improve health in itself and reduce the perceived inequities or social and economic gaps between the haves and the have-nots, yung pong rich and poor. And that is relevant because many agencies do not have a mandate with respect to cross-cutting issues. So most of the agencies po are siloed. Program lang nila, walang pakialaman. Hindi mo naman nakikita na everything is related to each other. Like schools, for example, it's related to transport. Kasi bakit? Kung hindi ka pupunta, hindi naman po lahat naka-boarding house. So yung iba uwian. So it's related to transport. Why is it related to health? Because in our own experience now with the pandemic, you cannot go back if you are not vaccinated, if you have not been boosted, or you could come back, but you have also the option to also think of the risks others will suffer if they were exposed to you. So remember, in an infectious disease, exposure is number one. So there are so many considerations that you should take into account and how they are related with each other. So issues like education, housing, agriculture, sabihin mo agriculture, may kinalaman ba yun? May kinalaman po yun. Food yun, food security. So hindi ka makakaaral kung gutom ka. Hindi mo maintindihan kung ano sinasabi ni Doc Emer tsaka ni Doc Patrick kung masakit na yung ulo mo sa gutom. So transportation, urban development, they are all addressed by other sectors, not health po. And other agencies which are also not health departments. So this is the social determinants of health in one figure. So your childhood experience, do you still remember how you grew up? Bakit ka ba mahilig ngayon sa maalat na food? Bakit ba kaka-doktor mong tao, mahilig ka sa Coke? Hindi mo ba naiintindihan yun ngayon? Because they are all wired to your childhood. Kung ano yung una mong nakita. Kaya for those who are starting on with families, very crucial po yun. Very big responsibility maging parent. Whatever you expose to your kids, they take it into adulthood. They either become a Jesus Christ or a Hitler, which gives me to think, paano kaya ni-raise si Vladimir Putin? Iba ata yung pagka-raise sa kanya, parang si Alexander the Great ata yung nag-raise sa kanya. So whatever it is that you were educated on, I do not mean grade 1 po. I do not mean kindergarten or prep school. I mean the environment where the child grows from the time they get out of the mom, they become a neonate to the first few years before going to school. Those are the times that the kid is very much absorbing a lot of things. So very crucial po yun. So those are the childhood experience. Do you remember? Of course you do. It's part of your long-term memory. And you never forget also the people who were kasi complete emotional eh. So yun ang unang-una before the intelligence comes first, the logical thinking. So I think those are the first things that really adhere to you, and that's why other products naman are very manipulative, like Coca-Cola nga or the other sodas. They usually associate happiness with their products. That's why you cannot get out of it. That's why you see doctors nga mahilig pa rin sila sa sodas and Coca-Cola. No matter what you tell them how high the glycemic index is and how it harms your body, it's not enough, because the wiring here in the first social determinant of health is very high. And of course, housing. Of course, not all of us are rich, so probably you were born in a meager average house. or if you're not so lucky, mas grabe pa doon, could be crowded. So ang thing with housing is you should provide adequate shelter, heating, cooling, temperature-wise, depending kung nasaan ka ng part ng mundo, and security. It should be secure enough to, make you sleep peacefully at night. And in times of pandemics, infectious agents floating around, hindi ka rin mahahawa with your other relatives. So that's an example. Education. So in certain countries, this is already free and mandatory. Part of the taxpayers' money go to that. Actually, madidemanda yung parents na hindi nagpapadala ng kids to school. There are already countries like that. And part of the the taxpayers' money go into good education. And then social support in cases that you get sick, in cases of disasters. What type of social support do you get from your local government muna? Kasi pag hindi na nakaya ng local government, you go into the higher government. And the other preventive things, much what Alvin was talking about on schistosomiasis, and Dr. Dayan was talking about cervical cancer, provided po dapat yan ng local government unit, much like your Pfizer, Moderna, Sinovac injections during the pandemic. Family income, magkano po yung family income? What can you afford to buy and not to buy? Of course, ang ating pong consumption needs are divided into needs and wants. Ayun po, magkakaiba yon. More on that, I think, on the lecture of Dr. Garcia next week. And then employment. How do you get to work? Sino po, saan kayo nagtatrabaho? How did you land your first job? And from your first job, how did you go from that job to another job? Then the community where you live in. Saan po ba kayo lumaki? This is different from when you were growing up, and this is also different when you were pag nag-settle down ka na. Eventually, baka magbago pa rin yon as you retire. So some people also try to go to some places when they retire. And then, considering from childhood to communities, what is your access to health services? Paano po, halimbawa, may naramdaman kayo ngayon, saan kayo pupunta? Totoo po ba yung dahil nagtuturo tayo ng correct navigation system sa healthcare, totoo ba sa health center kayo agad pupunta? So bakit yung tiyan nyo? Kasi naparami yung kain nyo kaninang lunch. O may nagsingit pala ng staphylococcus sa inyong na food poison kayo, knock on wood. Pupunta ba kayo sa health center to get help or diretso na agad sa ospital? Do you practice what you preach when you say navigating the health system should start in the health center? Or do you go agad to your friend doctor or the nearby clinic na hindi po yun yung tinuturo actually? So these are the social determinants of health. They are related. Most of them are non-health. So itong education, yung housing, even agriculture, sinabi ko kanina, social support, employment are all non-health, but they are related to your definition of complete social, mental, physical health. Hindi ka po magiging completely healthy kung hindi po maayos din itong social determinants of health. All of these also are dependent on how developed your country is. What is your development index for your country? Mamaya, discuss ko rin yun. So, the social determinants of health, social determinants theory can be mapped to concrete action. So, you can develop problem and solution trees. The solution tree is just the opposite of the problem tree. So, you could work with a group of informed stakeholders in your organization. For example, if you have a health facility, if you work in PGH, you can do that. Reach agreement on the problem to be addressed and ask, why does that situation occur? So any situation po yan. Would start from having a hemoglobin count of less than 10. 10 milligram per deciliter lang ang iyong hemoglobin, which means you were probably anemic. So that's the problem. So, i-ano mo na agad, ilista mo. Anong ililista mo? 1, factors contributing to the problem. 2, elements underlying these factors. Builds up layers of underlying determinants. So yung roots, the immediate causes of the problems, immediate problems that you have identified. And then the process continues until solutions become apparent or a certain number of level, 3, nag-stop ka na sa 3 levels nung kaka-YY mo. Why is this a problem? May sasagot. Why is that now the answer? Another level yon. Tapos sasabihan mo, why is that again the problem? So 3 levels po yun. Kaya 3 whys. Others go for 5 whys to come up with a real root cause. And then the impacts of the problem are also identified. So that is how you map the social determinants of health. At iba-iba po yun. So balik uli po tayo dun sa social determinants of health. Iba-iba po yan pag iminap nyo for every locality. Depende kung yung locality mo. It could be a barangay, it could be a CTO, it could be a purok, it could be a whole municipality, it could be a whole town, which means it's more complex, a region, and then of course the whole country. So ganun po yan, ganun po yung pagmap. Iba-iba yung problema ng bawat isa. And that is also the reason and the wisdom for the devolution law. Since marami po, naging complex siya, yung problema at yung root causes, government thought it would be better if solution would be coming from the people themselves who are experiencing this problem. And the resources provided coming also from the same people who are experiencing them. Okay, remember that. So ito po lang, ito ang core problem dito. Yung sabi ko kanina, hemoglobin reading of 10 milligram per deciliter. Siguro yun yung normal. 8 ka lang. So yun yung akin. So anemic kayo, mababa yung 8 na hemoglobin. So dito ang problema naman is low fruit intake. So gagawa ka lang ng iba-ibang levels. Ano-ano ang magiging problema dyan? Ano ba yung cause ng low fruit intake? So maybe it's not available. Maybe the price is high. Maybe there is poor knowledge. So it's either the 3. Ito yung immediate causes niyan. Poor awareness, mahal, poor availability. So ganun din po ang pwede nyong gawin dun sa mga pinili ninyo kaninang topics. Tulad kay yung cervical cancer. So you could state here why there is poor awareness or poor diagnosis, and then stem and create a problem tree. Babalik ta rin mo yung problem tree. As you can see, this is 1 level, 2 levels, 3 levels, and then 5 levels. Kung ilang level po yung ginawa ninyo, babalik ta rin ninyo yon to come up with the solution tree. And that is just how to parang immediately approach, but more on this on your HPAd 202, on how probably to approach a particular identified specific problem. Yeah, specific problem yan. Low fruit intake is actually a finding in the most recently done survey by the Food and FNRI, Food and Nutrition Research. Meron silang ganyang finding. Throughout the pandemic, bumaba pa ata lalo. Because of supply that was affected by the lockdowns. So, may epekto rin yan sa iyong health. So, yung lockdown, while it is a solution, it has also become a problem, which is an unintended consequence. We call that in health policy as an unintended consequence. So, there are also multiple determinants of health. Again, this is an ecological model from the Institute of Medicine, a model of the multiple determinants of health used to develop the action model of healthy people for 2020. Never happened because people were not healthy in the year 2020. And even with this ecological model, it was actually derailed by an unintended development, which was the pandemic. But you observe that in an ecological model, you have concentric circles. One of the concentric circles, you will find your social determinants, which are all development associated. Social, family, community networks, living and working conditions, broad social, economic, health, cultural, health, and environmental conditions. as well as the policies governing global, national, state, and local levels. So yun yung outer circle. And of course, overall, a person's lifespan. Yun yung mangyayari. Ang kalagitnaan po niyan ay yung tao. And of course, the innate demographic characteristics, age, sex, race, biological factors. Kasi lahat din tayo, hindi pantay-pantay. We're determined by our DNA. Depende rin kung anong mga namana mong sakit na predisposes you. Now, sa akin kasi kung ikaw ay nagkataon na, kaya dapat siguro pre-program na lahat when you meet somebody. First date pa lang, magkalabasan na ng DNA, DNA exam. First attraction kasi usually the physical attraction. Kasi hindi mo naman siya kilala, hindi ka rin niya kilala. So the only thing that bridges you together, what attracts you, is physical. Never the emotional pa, kasi di pa naman kayo di pa nga kayo eh. So, pero ang hindi nyo alam sa isa't isa, you have certain weaknesses. So that when combined, ibig sabihin, if you do indeed end up in a love affair and you get married, you might bear children who are going to be also condemned because of, certain genetic predispositions that combining both your genes and her genes might predispose them also to environmental stressors. Ibig sabihin, diabetic ka na, tapos yun nga, ang culture nyo pala, mahilig kayo sa matatamis pa, di patay na yung parang you are already writing your life as bata pa. So I think those things can be looked at if you are really trying to plan how your community, public health wise, should be designed or planned. Actually, the word rather than design would be planned, because when you plan, you're actually designing what you envision to be a better future. So yan po, multiple determinants of health. This is actually, as you know, medyo katawa na po, action model for healthy people 2020. Never happened. Yan po yung sasabihin ko. So based on the social determinants of health, how healthy you are today depends on how you develop during the first few years of life, so early childhood, how much education you obtain. These are all based on studies po. And being able to get and keep a job, what kind of work you do, kasi pwede kasing malaki ang kita pero drug lord pala. So very very prone ka to probable assassinations kasi high level target ka pala ng government. So what kind of work do you do? You could not be a drug lord, you could be a frontliner, which all makes it the more dangerous kasi frontliner ka, so exposed ka sa lahat ng biological agents and risk factors. What else? Having food. Having food on the table. Ito po yung food security. I'm sure alam ni ni Sir Alvin. Food security, having food and being able to get food. How readily can you get food? How available is food to you right now? Ngayon po na nakakagutom na dahil malapit ng magmerienda, 2 minutes na lang to 3 o'clock. How readily can you get food? Is it just a push of a button because of a Grab or Food Panda? Ganun po ba kayo kabilis kumuha ng food? Or malayo pa? Kasi kailangan pa mamalengke. So yun po yung mga at pagdating mo sa palengke, sarado na pala yung palengke. Yun po part po ng food security yun kasi supply yun eh. How readily can you get food? Having access to health services and the quality of those services. And living conditions such as housing status, public safety, clean water, and pollution. Speaking of clean water, I think clean water is forecasted to actually dwindle our supply in the metropolis by the time the elections are over. So as the new president is assuming position, may problema na agad siya other than the debts incurred from purchasing too much vaccines and masks and PPEs. So marami pong poproblemahin yung susunod na presidente. Kawawa rin yung susunod na Secretary of Health. Trabaho po yun. Ang laki ng trabaho na gagawin. So these are the things that how healthy you are today depends on these bullets. And how healthy you are also depends on how much money you earn, how much money a person earns, social norms and attitudes like discrimination, racism, a distrust of government, residential segregation, physical separation of races and ethnicities into different neighborhoods, social support, again, what I explained earlier on about in times of disaster and the pandemics, language and literacy, and incarceration. So some of us get into trouble criminally and we get into jail. So we cannot support our family. Culture, general customs and beliefs of a particular group of people. So some countries have different culture from ours. So hindi mo in-expect na ikaw pala gigirahin ka nung katabi mong country. So that might affect how healthy you are today. And then, of course, access to mass media and emerging technologies. You know what they are? Cell phones, internet, and social media. Now, how about SDI and HDI? Ano ba itong mga acronym na ito? Anybody know what SDI is? If you type HDI and SDI and what is the difference between the two? Na-try nyo na po ba itong ma-type sa inyong Google? Google search box? Ano po ang nakita ninyo? What is HDI and SDI? Andiyan pa po ba kayo? Iniwan nyo na ako. Bumili na ata kayo ng merienda, iniwan nyo na ako. Ma'am Christine, ano po ito?
Health Development Index po. Tapos yung SDIs. Dalawa na Social Development Index.
What does that mean? Why is that important for the discussion on health and development? So, nung una ako mag-type, ako SDI tsaka HDMI. So, ano pala raw yun? Tinuturuan niya ako mag-cable. Alam niyo ba yung HDMI, yung magandang ano sa TV? So, yun ang yun ang nakuha ko. At may SDI din na related din sa ayan, sa anything that has a monitor, cabling. So, hindi po yun hindi po yun ang atin dinidiscuss. So, ang SDI po is the Sustainable Development Index. It measures the ecological efficiency of human development. And it recognizes that development must be achieved within the boundaries of the planet. It was created to update the Human Development Index for the ecological realities of the Anthropocene. The Anthropocene is the time that human beings made an effort to be felt in this world. So the SDI starts with each country's human development score. Ano po yung human development score? It's your life expectancy, it's your education, and your income. Then divide it by their ecological overshoot, the extent by which you consume carbon dioxide emissions and the material footprint exceed fair shares of the planetary boundaries. So ito po yung SDI results globally, ganyan ang itsura niya. Tayo po is somewhere in 0.7 to 0.799. So hindi masama, hindi rin naman mabuti. So countries which are low in SDI, ito actually some of the United States, kasi yung inequity po between the two are high, and of course their carbon emissions are also high kasi these are highly developed countries, and so that's it. Most of Africa dito, yung mga lower middle income countries, medyo they are performing well. So take note of the SDI, the Human Development Index, and how it relates again to development. And of course the overall, yung slide ko kanina, what makes you healthy, how healthy you are depends on those things. And they actually just try to compress it into an index. So sa atin na lang, kasi this is HPAd 201, I tended to focus on the Philippine poverty picture, the common traits of poverty. Here in the Philippines, we live in rural areas, work in the agricultural sector. Most of them are farmers and fishermen. In urban areas, they are usually found in informal informal settlers po sila, the informal sector. They have large families. In a family, more than 6 ang isang family. And in 2/3 of the poor families, the head of the household has only had an elementary education or even hindi pa po nakatapos ng elementary education. They have no or few assets. Yung pong assets, yung ano pa ba yung pag-aaring yung appliances? Yun yung mga tanong dyan usually to portray your other asset po kasi yun. If you have a television, you have a radio, a cell phone, ayan, asset yan. Of course, a car, a house, yun po yun. And access to credit. Kayo po ba handang pautangin ng bangko? So, meron pong tinatag na credit rating. So, this is the common trait of the poor in the Philippines. What else? A major income source of the poor is from enterprise income. Informal sector activities, arawan, daily wages po sila. A significant segment of the poor are called chronically poor. And when it comes to Philippine wealth and income equality, the monthly income of Filipino families, wealthiest of the Filipino, there are only 12 na kumikita po ng over $1 billion. And this is as of 2015. I don't know if this has improved or changed. There are a total of 22.7 million families. So multiply that by 5. Kung 5 po kayo sa family, yun po yung population natin. So ang over 500 million to 1 billion is 15. Ang karamihan po ng pamilya ay nasa sa mayayaman 1 to 5 million dollars lang ang kinikita. 32,000 po sila. Yung over 1 billion, konting-konti lang. The monthly income of Filipino families, usually yung pinakamababa, 10,000 and below. 29% sila po ay 6 million. Titingnan nyo lang sino pinakamarami po dito. 6 million, 8 million, at 6 million. So, it's a mixture actually of the middle and the middle income countries. But again, please take note, this is a 2015 data. A combination of the family income and expenditure survey by the PSA and itong sa Credit Suisse na to, kahit na 2017 to, nakasource pa rin po kasi ito doon sa 2015 natin. So, wala po ang updated. But this at least gives you an idea of how many the poor among us and how many are the very, very rich. Yung tipo bang lumilitaw ka na sa Forbes magazine. So, ano lang yun? Less than 20 po. Less than 15 people kumikita ng more than $1 billion. So how many Filipinos are considered multidimensionally poor? And how does it compare with other countries? In the Philippines, the percentage of people who are deprived in ibig sabihin ng multidimensionally poor. You're poor in nutrition, high in child mortality, how many years of schooling did you have? How many years did you attend school? Do you have cooking fuel? You have drinking water, sanitation, etc. So ang greatest po na talaga na kahirapan is in terms of housing, 32.57, followed by sanitation, and I think cooking fuel is also high. 50.22% have no cooking fuel. Cooking fuel, housing, sanitation, and assets. So yan po yung kahirapan, multidimensionally poor. So how many Filipinos are considered multidimensionally poor? It's 6,181 ano ba yan? 1,000 ito in thousands. But this is again 2018 data. So yan po yun. So yan po yung sinasabi ko sa inyo na kailangan kasama sila. Kasi when you talk of the whole Philippines, kasama po lahat ng tao. Hindi pwede yung rich, middle income lang. So low to moderate economic growth for the past 40 years. We have low growth elasticity of poverty reduction. Nababawasan po yung poverty but napakababa ng growth elasticity noon. So causes of Philippine poverty po ito. The weakness in the employment generation, wala silang trabaho, that's why they try to get out of the country and migrate to another country. Failure to fully develop the agriculture sector, a high inflation rate, especially during a crisis or a catastrophe, a high level of population growth. So these are bad combination. If you have a low growth elasticity of poverty reduction and you couple it with a high inflation rate and a high level of population growth, that is not a good combination. These are the things actually that I would like to place on the table if I were to face any of the presidential nominees. Ano po yung balak nyong gawin in the next 6 years? How do you intend to address each of the bullets here? High and persistent levels of inequality. So income and assets po yun. And they dampen the positive impacts of economic expansion. Then recurrent shocks and exposures. We can never tell when there will be another super typhoon, another earthquake, the big one, as they say, and probably a World War III. Is that in the horizon anytime soon? You never know. So, ito po yung isa lang na gusto kong sana ma-download nyo po ito. A public health report published 2014, quite old, but it says that the social determinants of health, it's time to actually look at the causes of the causes. And each local government leader look at how it can be solved in their own particular area. Hindi po kasi tayo masosolve lahat yan sabay-sabay. So kanya-kanya tayo nang solve nung ating particular problem, especially in the devolved era. So yan po yun, isang proposition yan. The Philippines has proposed in the Duterte era, and tutuloy-tuloy naman po ito with the next president, whoever the next president is, they have to create their own long-term development goals. What is foreseen is that the Philippines will be prosperous by 2040, predominantly middle class, where no one is poor. Agree ako dyan, basta po makontrol yung population. I think it's achievable. Our people will live long, healthy lives, be smart, and live in a high-trust society. Where is this found? This is found there, yung po yung source, National Economic and Development Authority. So this must have been also updated kasi there is a new administration coming. So tingnan nyo na lang po and kindly read also the Philippine Development Plan and how it will change with the new president incoming. Ito po yung nakikita nila, may malasakit, may pagbabago, at may patuloy na pag-unlad. Bakit po inaaral to? NEDA na ata yan, Doc. Bakit tayo nag-aaral yan? Di ba DOH tayo? Ay, yung DOH po, pag naging strategic plan, ito po yung inaaral naman nila. So dapat po alam ninyo ito at pag ang usapan lalo na health and development. So paano po maa-attain yung matatag, maginhawa at panatag na buhay? And how? May mali dyan about health. Saan ba yung health? Nawala na yung health. Malasakit is the social fabric, but it is something that you should build. Ito, nandito tayo sa malasakit to enhance the social fabric and actually accelerate development with the inclusion of health and the achievement of the complete notion of health. And of course, ipinasok po nila yung social sustainable development goals dyan. Number 3, where is number 3? There is number 3. Doon po pala nakapasok ang number 3. Doon sa ilalim, ito nandito, accelerate human capital development and reduce the vulnerability of individuals. So doon po pinasok yung SDG 3, SDG 4, SDG 5 so that we can achieve it. Again, please review the National Economic Development Authority, the Philippine Development Plan, how it all relates to health as is envisioned. What is the World Health Organization, United Nations doing? They pushed for the Millennium Development Goals with the number 1, eradicating, ayun na naman yung usapan, eradicate extreme poverty and hunger. fast forward to 2015, ending in 2030 is of course the Sustainable Development Goals. Pero ganun pa rin po. No poverty and zero hunger ang top priorities nila. Because I think that is really the root of, health. So, yun lang po. And if you have questions, I'll entertain them very quickly. I think it's already 3:15 right now. Sorry for keeping you up, but I hope you learned something. So, andyan pa ba kayo? If you are there, I take a picture of your attendance. Meron po ba kayong 3 to 5? Am I keeping you? You have a 3 to 5 subject? Kung wala, so okay lang naman. May questions po kayo dun sa lecture? Naintindihan nyo? I'll share the slides also to you para po ma-review nyo in time for the finals which will happen. Kasi ang finals po nito ay departmental. So, kami po ni Dr. Patrick ay talagang tatanungin ng aming department kung paano kayo bibigyan ng exam at pabibigyan ng exam. So, 1, 2, 3, smile po. 1, 2, 3, smile. Okay. Have a happy weekend of what remains of it. Ano pa bang natitira sa yung long weekend? Sana may natitira pa. Saturday evening, Sunday, and then back to work again. Sige po, maraming salamat. I'll see you in Canvas. Please, at least I will send a message po sa WhatsApp pagka okay na. And have a feedback po sana sa akin. Huwag po niyong kalimutan yung assignments ha. Please turn them in. Okay po.
Okay po.
Thank you. Bye-bye.
Thank you.
Thank you, Dr. Pat.
Thank you po.